On September 3rd, 2009, U.S. military authorities announced that all military personnel will be ordered to receive the vaccination against the H1N1 flu virus. The vaccination program will begin this month, according to officials. For myself and many others, there will be no choice. We will line up and take the vaccine when told to do so. However, through my speech today, I hope to educate those of you still left with the choice and explain why receiving this poorly tested, unsafe, and ineffective vaccine is the wrong choice, and that if you care for the health and well-being of you and yours, you'll stand up and say no to the H1N1 flu vaccine. Now, over the past several months, our government has been involved in a fear-mongering campaign determined to convince the American people that the H1N1 virus, or swine flu as it's more commonly known, has grown into a major health threat to the American public, and that if no preventative action is taken, that is, if you don't receive this vaccine, that this health threat could possibly turn into a national pandemic, and by some accounts, it already has. Figures and statements being thrown at us by the White House include 50% of all the American population could become infected, or 1.8 million could end up in the hospital. 300,000 will end up in ICU care. Just visit www.whitehouse.gov for some of these alarming statements. It would seem that the government is trying to paint a very scary picture. So, despite what the media and the government would like you to believe, here are a few reasons why you and your loved ones should not be overly concerned about the swine flu. And more importantly, why you should not vaccinate you or your loved ones against the swine flu this year. I'll first touch on the exaggerated statistics being reported through the media and other governmental agencies. And then I'll talk about the vaccine itself and why anyone with any amount of knowledge as to what's in this stuff would say no. First, let's talk numbers. Now, the H1N1 flu is simply another strain of flu. In fact, the H1N1 swine flu currently in circulation is less deadly than many other outbreaks of the past. According to the Center for Disease Control and Prevention, that's www.cdc.gov, approximately 36,000 U.S. people die from flu-related causes each year. Not just the swine flu, but all flu-related deaths. Again, that's 36,000 people. Now, what about the H1N1 swine flu, you say? Well, according to flucount.org, as of 12 October, there were 907 confirmed swine flu deaths in the U.S. since its outbreak. These are non-CDC confirmed or verifiable reports. However, assuming these numbers were even gross underestimations, 907 confirmed H1N1 deaths compared to 36,000 regular flu-related deaths each year, even the WHO has reported only 4,700 H1N1 deaths worldwide since April 2009. And this is compared to 36,000 U.S. flu-related deaths yearly. Hardly the exaggerated state of emergency the media would want you to believe. Now, what about all the child-related swine flu deaths that have so many parents up in a frenzy? Well, going back to the CDC website once again, one can read that the death rate from this flu season is actually lower than that of the previous two seasons. Starting in 2004, states were mandated to report to the CDC flu-related child deaths, that is, individuals 18 and younger. According to the CDC statistics, as of this week, week 40 out of 52, during the 2009-2010 flu season, there have been 43 flu-related flu deaths. 39 of those 43 deaths were H1N1 virus. And what about previous years, you ask? Now remember, 39 H1N1 child-related deaths this year. 2008-2009 saw 115 flu-related deaths in children. 2007-2008 saw 88 flu-related deaths. 06-07 saw 78 flu-related deaths in children. The 2004 and 2005 flu seasons saw 47 and 46 child-related deaths respectively. And what about 2003? 153 flu-related deaths in children, the highest since CDC started taking stats. Coincidentally, it's the same year as the avian influenza outbreak or bird flu outbreak that caused much panic in the U.S. as well. So now that I've discussed some statistics with you, let's talk about the vaccine itself. This is the first time ever that mock vaccines have been used to gain FDA approval. That's right. The U.S. government has hastily pushed through these mock vaccines to gain approval of only the manufacturing method. These mock vaccines, which were only tested on healthy kids and adults, not the pregnant, not the sick, not the elderly, they're not even the same vaccines that you or your children will be given. The H1N1 vaccines that are currently being mass produced are completely different concoctions than the mock vaccines, and they'll have different additives called adjuvants, as well as various manufacturing methods. Some of these additives include mercury, thimerosal, aluminum, and squalene. The vaccine themselves are proven neurotoxins that have 25,000 times the level of mercury than would be considered toxic if it was in your food or water. Even the manufacturers of the vaccine themselves are unable or unwilling to assure the safety or effectiveness of the H1N1 vaccine. Don't believe me? Novartis, Sanofi Pasteur, CSL Biotherapeutics, and MedImmune LLC. These are just 4 of the current manufacturers of the H1N1 vaccine. Each company has provided their own liability statement directly on the product inserts. Let me read this. Safety and effectiveness of influenza H1N1 2009 vaccine have not been established in pregnant women, nursing mothers, children less than 4 years of age. Now I ask you, would you be willing to inject a product into yourself that even the manufacturers aren't willing to stand behind? So, I've talked about the skewed statistics on H1N1 reported cases and deaths. I've also spoken briefly about the vaccine itself and its contents. Well, what about the media? What about the news and all the startling reports? Well, I say irresponsible, unfounded, and quite frankly, unethical. But why would they twist the facts and figures? Well, just as everything else, if it's not alarming, it's not newsworthy. And unfortunately, news organizations' political affiliations have, once again, influenced their reporting. Were you aware that initial hopes of the current administration back in April of this year were to produce over 200 million doses of the H1N1 vaccine? This equates to tens of billions of dollars in profit, a huge economic incentive not only for pharmaceutical companies, but also for an administration looking to get itself out of its current economic situation. And they're doing all this by scaring people, putting fear into their lives, and hoping that regular Joes like you and I aren't smart enough to read and research on our own. As I've already stated in my introduction, the choice has been taken away from me. However, the only question I have for you is, will you make the right choice when presented with whether or not to take the H1N1 flu vaccine? Thank you very much. Have a good day.